Statistics show women live longer than men by an average of almost 5 years, according to the World Health Organization. So it is important that men know what their greatest health risks are and also take some important steps to reduce those risks. Dr. Sean Snyder is a provider with Pacific Medical Centers, and since June is Men's Health Awareness Month, he's here to talk about early detection and 3 major health issues that men face, including heart disease. So thank you for being here. Let's start there with cardiovascular disease. What is most important for men to consider when taking care of their heart?
I think it's knowing your risk. Because a lot of the risk factors that you might have for heart disease you may not know about. They're not going to give you symptoms until it's too late. And so, regularly seeing your primary doctor and knowing what puts you at risk, and things like your blood pressure, your cholesterol, family history, understanding your risks and having an individualized plan for managing those risks.
So how often should a man be going to see his doctor?
I think absent seeing them for specific, acute concerns, in general, at least once a year, for a checkup and, health maintenance sort of things.
A physical, or is that more extensive?
I think it's essentially the same. You're getting a physical, and you're checking not just a physical examination, but you're also looking at these things that need to be checked on a yearly basis, at least things like your blood pressure, like your cholesterol.
Preventative care is so key, which brings us to the second big health issue that men and women face, and that, of course, is cancer. But what should men be really thinking about when it comes to prevention and early detection in terms of cancer?
I think it's knowing your risks, again, and family history is a part of that, and there's certain age-related risks that people of certain ages should be screened for regardless of any family history, and understanding those risks, and that's something you're going to get, from your primary doctor.
Is there a screening out there that really shows great results when it comes to prevention in certain cancers?
I think that colon cancer screening is probably one I'd focus on, and getting your colonoscopy when it's recommended, because that's one where, catching something early can have a really big difference in your long-term outcome. Okay.
What is the age that a man should go have a colonoscopy for the first time?
Typically 50, but if there's a family history of earlier disease, or certain more rare genetic things, there are reasons sometimes we do it sooner.
Okay. Finally, nutrition is something men, especially as they age, struggle with. So how can they make this a priority in their lives? And if they need to make a change, make it soon?
I think, the main concern when you look at nutrition is specifically with obesity, and that's a, big thing and a growing problem in this country. And there are certain specific, directly things you might find related to your obesity, like diabetes, and certainly that's something that might really cue people in. But, in general, for the risk of a number of things, diabetes, cardiovascular disease that we already talked about, not being obese can really improve your risk.
Yeah, focusing on diet and exercise, all those things that if you go talk to your doctor regularly, they can alert you to any problems. Dr. Sean Snyder, thank you for being here, focusing on some important health topics that men face. And if you'd like to read more, you can always go to our website, q13fox.com/healthy living.